Hello again, everyone. Mark Hackle, Macomb County Executive, Deputy John Paul Rea, just giving you an update what's going on with COVID. And, we know there's some challenges out there, once again, with getting people vaccinated. There's a tremendous amount of people that want to be vaccinated, that are allowed to, and very few doses available. So let's kind of get to a new formula we put up here in the dashboard so people have an understanding of what's going on. The health department, along with our planning folks, we're able to put together a dashboard so people can see it right at the front of our website, macombgov.org. You're going to be able to see this, along with a multitude of other informational opportunities for people to see what's happening and know statistics and numbers. This one seems to be the one most people are focused on, what's happening, and basically why can't I get a vaccination. So past week, we were able to get 5,850, of which we immediately opened up on Tuesday after we knew how much we were getting, the phone lines as well as the website for people to go ahead and log in. And record time, probably less than 15 minutes, all those doses were spoken for. But to date, what we've been able to do is 21,175 we have received from the state, and we have administered already, actually given people the shots, 14,941. And so with that, we know there's still 6,234 people that have appointments that are getting those vaccines either today, in through the weekend, or even on Monday. So all the doses we get are always spoken for and administered. You can tell by adding the two together, it equates to the 21,175 that we have gotten. So nothing is left in the freezer. And by the way, I mentioned the freezers. We had purchased 5, and right now we've only been able to use 1. And again, basically just 2 shelves in that 1 freezer because of the lack of doses that we're getting from the state. So that becomes a challenge, but we just want people to see front and center what we get is what we're giving out, and so they can actually see it based on the numbers. And we know we can do far more.
Yeah, Mark, transparency is key throughout this process. And again, the illustration that every single dose Macomb County receives from the state of Michigan is accounted for virtually the instant that we obtain it. The system that we have put in place, the ability to open up that to our entire priority group population first thing Tuesday morning is the most equitable way in which we're rolling this out. This week, too, we also had an opportunity to engage the healthcare systems, see their vaccination rollout, get a better understanding of how that's going to impact the larger population and priority groups around the county, and then also continuing to advocate for the state, additional doses coming to the local health departments so that they can get it to the larger priority groups across the county.
And talking to our healthcare systems, independently, we talk to each one of them, and so having a conversation, they too are, confused as to what their real role is and who's supposed to be doing what at this point in time. I think most of the healthcare workers that wanted it have already gotten it, and now they're figuring, okay, we got these doses, how do we get it out to the public? And they're getting inundated like we are with people calling in. Even though they don't have an open line like we do, health departments do, they're still getting those calls from the various sectors, and they too are saying, you know what, I still think we need to focus on those that are 75 years of age and older, 65 with some underlying health issues. So they're trying to be a little bit more target specific to help that group, because without question, data, science, statistics, CDC all indicate those are the ones that should have went next as opposed to everybody else being a part of that process. However, we know that it's been open, and so with that, it's created that incredible, if you will, traffic jam of people wanting to figure out how do they get it on Tuesday. We don't know yet what we're getting. It is Friday. We don't know exactly how many doses we're getting, Monday, so we can start scheduling appointments, and we never get ahead of it. Boy, I tell you, we've gotten calls from people, with all kinds of ideas on how we should handle this, and one of those has been this, well, you should just take a running schedule out for the next 3-4 months, and you know what, we don't promise anything we don't know we're going to have, and there's a number of reasons why. Some have tried to do that, and boy, they've run into some incredible complications by trying that system.
Mark, you get difficulties not only with regards to scheduling that far if you can't ensure that all the doses are going to be available, but then the other thing is, God forbid you should wake up and those doses aren't there that day, having to reach out to those folks and inform them that, I'm sorry, your appointment has to get canceled. We want to deal with the most reliable metrics, we want to deal with the most transparent figures and numbers, and we also want to assure individuals that when you do have your time in line, you're going to come to our facility, you're going to get that dose. That's the way that we're operating right now. That's the way that we can be open and honest with the public, and most importantly, that's the way that we're going to continue to operate and advocate for additional doses too.
And you don't know what's going to happen too. If all of a sudden we do, maybe we schedule for 5,000 people to get doses, you schedule out, and next thing you know, we get another 10, we get another 20,000 that come our way. So what does that mean? Those people have been scheduled out 2-3 months down the road, still have their scheduled appointment, but now we can open it up to some new people that'll jump the line. So it's just very logistical challenge for anyone to try to figure out how to schedule that. We understand how to deal with these things. It's just going to be that continuous frustration on behalf of people that don't get through the phone lines. And we hear the emails all the time. I tried 200 times. I tried logging on 200 plus times. I still can't get through. Well, anyone who has gotten any of these appointments had to go through that same process. So unfortunately, they too were trying multiple times and continued to try with the frustration. Maybe didn't get it the first week or the second week, but they were lucky enough to get through on the third week. There's no question. It is a challenge. And so with that, until we start getting more vaccines, this is going to be the continued process or problem we're going to be seeing. And we have, again, reached out to the federal government, 50,000 a week, and even the state, we request 50,000. Even though the state sent us a letter and said, don't request any more doses, we're just going to give you allotment, which once again, we don't know what that is, and probably hopefully Monday we will know what that is. But I said, we are still going to request 50,000 from the state. We're not just saying, okay, we're not going to ask for it. We will ask for it, and the reason why is because we know we can do 50,000 a week and take care of that, if you will, inundation of people that want to get scheduled. We can do it if we get to 50,000. So we're committed to that. We know our folks at the health department can manage that. It's just a matter of trying to get through. And it just seems, it's just a repetitive process. It seems like every time Tuesday comes around, it's like we continue to try to educate the public. You know, we understand there's a limited amount of doses and you are going to get frustrated. And there's no way around this until we start getting more doses and opening more access points. And that's the other key, opening access points when we have more doses so people have other areas to go ahead and say, hey, I want to schedule an appointment, not just with the health department.
Mark, we've had extensive conversations with the state this week and our regional partners with regards to opening up those access points, ensuring that those enrolled providers, when we do hit benchmarks on additional doses, are brought into the fray so that there are diverse entry points where people can go in and get these doses. The same way that we vaccinate in other arenas, whether it's the flu, whether it's the mumps, whether it's the measles, using the pharmacies, using the urgent cares, using the primary care physicians, using some of these external clinic sites that some of the hospitals are using. That's going to create more entry points for folks to access these doses and alleviate that demand that keeps building up every single week as there's limited doses in the queue.
Yeah, so as I always say, try to figure out how to get maybe online or a phone call for someone who is a senior rather than just yourself. And again, I know there's self-preservation, people want to take care of themselves, but right now the challenge is with our seniors, 75 and older, those that are 65 with underlying health issues. If you know someone who lives in a county that is somebody in that category, please try to log on for them. I say that because you know, that to me is you know, the most important, I guess, group right now that should be targeted. So with that, we know we have plenty of information. As you can see, we are going to continue updating this dashboard. There will be a date as to when it was last updated so that you kind of have that information readily available to you. And you know, with that, we know we have a ton of other information for people. You know, where you can be tested, we still have the test site that's available, and they're running a great, they're doing a great job of getting people through that process. The actual dashboards that we have, you know, for the actual numbers as to, you know, statistically what's been happening in the county. We often give this up. You know, JP going to let him take the lead on this. But once again, we're seeing here in the county some pretty good numbers when it comes to dealing with you know, people that are testing positive and deaths.
Mark, positivity rate under 7 now for a while. That's been a very nice steady figure that we've been seeing as we've been not only continuing to inform the public with regards to the spread of the virus, and as we continue to work with our friends and partners around the region too. Looking at the risk levels, understanding where we're at on this end, I think we're at a nice stable arena where individuals are taking those precautions, protecting their friends and family. Schools opening back up again is another great step. We're getting everything back into that mix too, and then at the same time really seeing how these cases are being managed by our healthcare providers too. Some positive things with regard to the case statistics and everything like that, and obviously attributed to those facts that, you know, the number of individuals that have been received the vaccination here in the county too. So good positive metrics, not only on the dashboards for the county, but also for the region.
You know, understanding to the schools of the partnership we have, the ISD, Mike DeVault, and all the superintendents, as well as the school districts, and working through this process. You know, the number of cases that they sometimes report, you know, that they have a case at this particular school, whatever, most of it is because they got it someplace outside and they reported that their child has it and they're not allowing them to school, but then it kind of comes as a number of that school has reported a positive case. Again, I think there's a confusion there. Some people believe it's like, oh my God, there's something running rampant at the school. That's not the case. They're doing a great job of keeping that away because of the systems they have in place. So the schools have done a great job, and we're seeing them starting to open back up as they're being required to, you know, by the state. So we're going to continue to work with them, our health department, and understand that we have not been punitive in any regard with our businesses and our schools or anyone. We're trying to figure out how do we engage and work with them to understand, you know, what's going on voluntary compliance is the best type, but educating them, I think, is more important. So we're going to continue to educate, trying to get people to understand the issues here, understand the numbers, what's coming our way, the variant that might be, in and around the area. We're trying to make sure that people truly understand our health department is there to be supportive and to be, a partner in this process, as opposed to trying to figure out how do we, write citations and violations on this issue. They've been hit hard enough.
Absolutely, Mark. It's about allowing people to be part of the solution, and that's the thing with all the information we're getting out through our health department. That's the thing with working with the healthcare experts around the entire region, and most importantly, that's the way we're going to continue to leverage MacombGov.org and get that information out to the public.
And speaking of which, we kind of had this opportunity for people, the Macomb County Cares for small businesses. There was some money that came from the state that came our way, about $4.1 million, $4.2 million.
Correct, $4 million.
So about $4 million that came our way. We were able to reach out to those most impacted businesses. And boy, we got inundated with people that wanted it. Very small amount of money, 4.1 or $4 million. Didn't go a long way trying to figure out how do we help them. So we had to be very target specific. Basically, your restaurants, some of these other facilities, that banquet centers and bars, they're the ones that have been, without question, most impacted. So we're going to be leveraging a lot of that funding for them. Unfortunately, that means a lot of people that did apply, are probably going to be turned away, even though we're looking for it, because of the fact that limited, but we needed to make sure we were doing something significant for the bars and restaurants here in the county.
Mark, limited funds available, very strict regulations from the state as far as those businesses that had to be impacted by the two pauses we saw in November and December. Very targeted and specific also with regards to the industries too. And then the other thing too is with regards to any other regulatory elements from the state. Our planning department has done an exceptional job going through those regulations, ensuring that we have the highest degree of compliance with all those statutes and standards. And we're very much appreciative of the fact that we can help a small number of businesses, but as you've highlighted, the need far exceeds the resources that are at the table.
Yeah, so in this point in time, people need to understand there wasn't something for everyone in this pot of money or this particular round of grants that were available. So more people are going to be turned away than, or probably not receiving funds than will be receiving funds. So, we know there's going to be some probably people that aren't going to be too happy with that, but we had to follow the state guidelines and regulations on that, and the planning department kind of vetted each and every one of them.
Absolutely.
So it did a good job. And again, just real quick, we tend to forget that there are other things that are going on. Road projects. This is also on that front page of the website here, MacombGov.org. You can go to the road projects, take a look and see, what is going on or what is scheduled for this year's road projects here in Macomb County. Very interactive map. You can actually touch the road. You can find out whether it's a bridge being fixed or whatever. Here are the road projects. In fact, over on the right-hand side, bridges, what we have available, and road projects, the construction projects that we have slated for 2021. So again, we're going to continue to add to that what we have. Mound Road, major project we got going out. So you can even go to Innovate Mound, that website, to get a real in-depth look at what we're doing with Mound Road. So a lot of things that are happening. We're not just, completely focused on what's going on with COVID, although it does take up most of our day and most of our challenges, and specifically, how do we get more doses so we can get those to the public that wants them.
Mark, it's great to know that even places like the Department of Roads, as we continue to populate this list more and more, as those projects get updated through our affiliated providers too. And the other thing I'll just click back on right now also. Oh, I think you got to hit, if you wouldn't mind hitting the back button for me real quick. So also, obviously, Veterans Services, as those folks need to get those resources available. I know Laura Rios and her team are working our Community Action Agency with tax assistance, so that information is going to be integrated on there too. And as always, support services available through our good friends at Macomb Community Action, the helpline 586-469. 6999. So again, 586-469-6999 for all those that need assistance throughout the community.
Yeah, and again, the veterans thing, very important, especially then tax season's coming up, and they will assist. They will give you some support and help. So again, we're going to continue to try to fight for more vaccines for those that want it here in Macomb County. In the meantime, we know that there's still a concern amongst us, a new variant that possibly is coming, that actually has come to the state, not quite here yet, but you need to be very mindful of that, especially now that kids are going back to school and people are starting to interact once and more. And we know that they're opening up restaurants on Monday as well. So, we're thankful for that, and we're going to continue to work with our restaurants, and we know they want to keep their employees as well as patrons safe. So, I'm glad to see that, and we're grateful they're back at least opening to some extent, but a lot of strictness in some of the guidelines. So with that, we want to continue to remind you to keep you and your family safe.